It's got a list of all your medication.
Michael Atkinson is still trying to piece together what happened when he was discharged from the Royal Bolton Hospital. 3:30 in the morning, and disorientated after a suspected stroke, he set off to walk home, even though it was below freezing. All he remembers is being found an hour later, cold, distressed and in pain, by 2 police officers. Several months on, he still has nightmares.
It's the thought of seeing these 2 shapes and thinking that I was going to be mugged, murdered, anything, you know. It's in the back of my mind all the time, even now. It frightens me.
2 years ago, NHS England told hospitals to stop discharging patients overnight, but Freedom of Information requests by Sky News reveal the practice is still widespread. 72 hospitals were able to supply figures for the last 3 years. 31, almost half of them, reported an increase in the proportion of patients discharged between 11 p.m. and 6 a.m. In the last year alone, the hospitals discharged more than 152,000 patients. The Patients Association fears it's being done to free up beds in busy hospitals.
They've got people chomping at the bit in the A&E, lying in corridors. They've got to be admitted and they have no beds. It's for the convenience of staff and the convenience of that person they're admitting, but at the gross detriment to the person that they're chucking out. And I do say that, chucking out.
Elderly care homes say they're having to take in frail and frightened residents in the early hours, often with little warning.
They're going back without any relevant information about how their care may have changed, what the diagnosis might have been. The paperwork isn't following because people will be off duty. And very often they come without the relevant medication they need for the following day or even through the night.
It's hugely unsettling for elderly and vulnerable patients to be discharged from hospital and sent back to a care home in the middle of the night. But at least here there is somebody to look after them, however inconvenient. There are other patients sent back to their own home alone, perhaps with no family nearby to support them.
In a statement, NHS England said discharging patients at night without appropriate support is unacceptable, particularly if a patient is vulnerable. It should be accommodated only where it is safe and clinically appropriate and with the support of family, friends or carers. The Royal Bolton Hospital said Michael Atkinson hadn't been formally admitted to a ward, so he could be sent home at any time. It insisted that staff had been trying to arrange transport, little comfort to his family.
You're in hospital for a reason, to be looked after. That's the be-all and end-all. And they didn't look after him. And he's not the only one. There's many more, and I think it's got to stop.
Thomas Moore, Sky News.